I'm Anne Kiltie. I'm a clinician scientist, a clinical oncologist working at the University of Oxford in the UK, and I'm one of the ESTRA representatives on the EMUC18 committee. The highlights of the meeting for me as a clinical oncologist was the synthesis of both the HORAD and the radiotherapy arm of the STAMPEDE trial that was presented with the two major presenters and discussants yesterday in the meeting. And the take-home messages from the data were that although when you treat all comers with metastatic disease with radiotherapy primarily to the prostate itself, you have no benefit in overall survival. When you actually look at the men that have only a small number of bone metastases, so less than 5, certainly in STAMPEDE there was a significant benefit in overall survival. In the HORAD trial, which was much smaller, it wasn't significant, but what they're going to do now is do a meta-analysis by putting the two trials together, and that will give us level 1 evidence, which hopefully will show that this is a new standard of care in prostate cancer, treating the primary as well as dealing with metastatic disease in low metastatic burden. So another interesting presentation at the meeting was by Philippe Lambin, a radiation oncologist from Belgium, and he told us about radiomics, which is an exciting new field where by taking the anatomical data that you derive from CT scans or PET scans or any other radiological data, you can actually then synthesize biological data where actually the results actually look more like the heat maps you see from biological data from RNA sequencing or other biological data, and that you can actually use this to help treat patients at various levels in prostate cancer, in active surveillance, in looking at following up patients before treatment and in the actual treatment itself. I think it's hard to tell for radiomics when they will become integrated into clinical practice, but I don't think it'll be long. I think there's an awful lot of people researching this at the moment. It all looks very exciting, and I think there's a real chance that this could be integrated into clinical practice in the near future.